Hi, Craig.
Hi.
Good to talk to you. And I want to ask you a little bit about the integration of the Housing Plus Services model called the SASH program into your statewide healthcare reform effort. Can you talk a little bit about why you made a decision to include that program in healthcare reform?
Well, from the beginning, when we started working on our blueprint model, we really wanted to emphasize building a strong community health system structure, tying together medical services with non-medical services, with social services, and build a real seamless network. That was the vision for this. But as you point out, we brought in from the get-go services in housing sites. And we thought there was a tremendous opportunity there. It's a place where some of very high need population, seniors, often lower socioeconomic status, they live. This is where their life is centered, and it was a great opportunity to bring people to their setting. The SASH program is being evaluated as part of our overall healthcare reform model, the blueprint model, and it's being evaluated independently. It's clearly making a difference in terms of helping with expenditures, healthcare expenditures. It's helping to control the growth in healthcare costs. So the SASH program, I think, has gone from a stage at which people were surprised that we would bring that in up front as part of a health reform model. And now it's gone to a place where people look at it and say, this is a tremendous asset. We want to know how to connect better with it and actually get the information they're collecting in people's homes. It's tremendous progress, really.
That's great, Craig. One of the things that we're really interested in is the fact that you've seen SASH as actually an extender of those medical homes. And I'm wondering if you could just talk a minute about the real connection between the community health workers and the SASH service coordinator wellness nurses, because, that is an important piece of this connection.
The personal relationships that have developed between the SASH teams, medical home staff, community health team staff, and others are extraordinary. And at first, there was even some resentment by organizations and communities that said, we do this. And we would say, you do provide services, but it's not the same as being embedded in the housing structure. It's not the same as being there every day and getting to know these people when they get together for lunch and talking and meeting and becoming part of their social network. It's different. When you are working in a traditional way and Medicare allows you 3 visits if you meet certain criteria, it's very different than being embedded in there. So what we're working on now is the plans of literally the next phase of this. And that's where the new accountable care organization, SASH, designated agencies for mental health and developmental services, the Visiting Nurse Association, a collection of medical and non-medical providers are now going to be organized in a new way with actually all of them being part of a leadership team to make a more of a formal structure to these community health systems. And SASH has gone, the support and services at home has gone from being an outlier to actually being a pivotal part of the leadership team on this.
That's fabulous. And you've actually answered my last question, which is, as you move towards more of an ACO, accountable care organization concept in Vermont, it sounds like housing is actually being considered as an integral part of that coordinated effort.
They really are, and they deserve it. I mean, the housers have done such a tremendous job organizing this. They have a different kind of relationship with their community, with the people that live in their sites, than does the medical community. They brought some real strength. And the ACOs, if you think about it, they bring a unique organizational structure with providers of similar types.
Right.
So they can work within their own organizations to improve quality. And the community structure with the housers can really help make sure that these connections get made. And so there's a lot of synergistic, additive capabilities there. And we're formalizing a structure to blend them. It's really exciting. And if we can move to that next phase, I think we'll see a community health system structure really take hold in a much more formal way.
Fabulous. Thanks so much, Craig. And thanks for talking about this innovation in Vermont.
Sure. Thank you. Thanks for having me.